Dr. Bolton. I'm the lab director for the Lakeside Medical Center Laboratory. Well, for medical director for this hospital has been right now I'd say 10 years. Roughly 2011 is when I started out here as medical director. My primary function really is to be an interaction between the medical staff and the laboratory to help coordinate and make sure every laboratory test that is produced is producing meaningful results that the clinicians can interpret, and at the same time be available should they have any questions on how to interpret those tests or maybe further selection of what tests are needed. As an undergraduate, I was a microbiologist by training, and a chemist. So, I was really in tune to all the different stuff that they do in microbiology, the plating, the genetics of the microbiology organisms, and how to make good diagnoses using those tools, all the chemistry that goes with that. So that all ties in. The laboratory is microbiology as well as blood bank, but you get out into the chemistry, everything else, and you've got to make sure the instruments are running correctly. In microbiology, you've got a lot of judgment to make. You get a sample, a sputum, whatever, and they take it and they plate it out, and then someone has to visually look at that plate and try to separate out what's normal organisms and what might be a pathogenic organism, and they have to then select those organisms off that plate to then further run the testing on those. So it's a lot of good quality education. Microbiology, you can't just come out of training. You need many years of good experience to get to have that instinct as to what you're looking at. My specialty starting off used to be way back when in molecular, before PCR even came out, and immunology. Those two were my focused areas, and a bit microbiology. They all tied together back then. But right now it's been almost all anatomic pathology as well as the clinical, so completely broad spectrum. You have to have a fully functional laboratory in order to provide the doctors meaningful results in a timely fashion in order to manage the patient's care. And they have to have good quality results. If those results aren't of quality, the physicians don't have trust in those results. They're not going to think about how to act upon those data points that are produced. Because there's so many things that have to be interacted. It's not just the equipment, making sure the quality of the test results are there, making sure that all the technicians or technologists can run the instrument properly, making sure that the lab results that go from the instrument out to the interface, through the interface out to the doctors, is sending the correct results out. Maintaining a staff out here because of the distance, turnover. It's hard to keep a good quality staff out here all the time. And that's a general shortage nationwide right now. But I mean, the technologists constantly recognize tests where something coming off the instrument doesn't seem right to them for one reason. And they go back and they'll either consider needing to get the patient redrawn or or repeating the test value to make sure it went through right, because every time an instrument runs, there's a chance that it can get a micro bubble or a pipetting error, or something can happen in the instrument and a result can come out spurious. So the techs are constantly looking at what's referred to as delta checks and flags on the instruments, as well as their own gut instincts on a test. So if patient's been running, say, a hemoglobin of 11, and all of a sudden bumps up to 14 and didn't get transfused, they say, okay, something's wrong. Or if they were running that same thing and bumped down to 4, is that a massive bleed or was there something wrong? So the techs are key. The techs don't have all the diagnosis and history information, and they get a result that doesn't completely make sense to them or has something abnormal. They're trying to figure out what that abnormality is, be it a microscopic hematology slide, or which is probably the more common area, or a coag that doesn't make sense to them. It's so far off it doesn't make sense, but it might be so far off because the patient just started a new medicine or a new drug, and that's what's throwing the result off. So they'll have to call the physician, talk to them, find out what's going on, and then decide whether they want to rerun a test or not rerun a test. Sometimes they call me. we discuss it first, and then I either call the physician or have them call the physician. So it's an ongoing process. And we get a variety of things from surgery. I've seen some colon carcinomas and other things come through from surgery. So we get a complete diverse spectrum. This is on the scale of hospital laboratories, it's a relatively smaller sized hospital. It's a smaller sized lab, but pretty much as far as a bigger lab that's 4 or 5 times this size, you have almost all the same testing capability is here. So it's very, very, very compact, but very efficient is what it does. I think the technologists out here are very dedicated, a crew that have put in a lot of work to get the job done.